It's the thing that everybody fears, the ticking time bomb in your health that could suddenly thrust you into a medical emergency or possibly even take your life. That is why we are recognizing Sudden Cardiac Arrest Awareness Month in our local health community. And joining us for more insight on sudden cardiac arrest is a senior staff cardiologist at Henry Ford West Bloomfield Hospital Clinics, Dr. Vaidahi Patel, with us on Splash Live. Thank you for being with us, Dr. Patel.
Hi, thank you for having me. Good morning.
Glad to have you on to talk about this. It is an issue that is very serious and that people need to be aware of for their own health and safety and for that of their loved ones and others in their community. And I guess the best place to start is defining sudden cardiac arrest, which is often maybe misconstrued on the basic level from novice's standpoint with heart attack. How are they similar and how do they differ?
Yeah, absolutely. So I think the key to kind of differentiating the two is what a heart attack is it's when you have a sudden blockage in one of the blood vessels that supply blood to the heart. And oftentimes people will describe having symptoms of chest pain or shortness of breath. What cardiac arrest really is it's kind of the sudden stopping of the heart electrical activity. The heart stops pumping blood entirely. And so all the organs are no longer getting that critical blood they need to survive and function properly. And often you'll see patients and people just suddenly collapsing. And so heart attacks can lead to sudden cardiac arrest, and they often are the most common cause of cardiac arrest, but cardiac arrest can happen for a lot of other reasons as well, genetic conditions, sometimes trauma, injury, many other causes for that as well.
And when people think about these cardiac issues, they often think about our aging populations or others with some of those common risk factors, maybe like obesity or those who have been smoking for a long time and may have those underlying issues, but who really is at risk for sudden cardiac arrest?
Yeah, really, anyone can be at risk. Typically, yes, the if you have risk factors for heart disease in general, that places you at a higher risk for sudden cardiac arrest because it increases your likelihood of having cardiovascular disease. So certainly being older, smoking, high blood pressure, having underlying coronary disease. But that doesn't mean that if you don't have those, that you are protected from not having sudden cardiac arrest. We can see it in our younger patients as well. Sometimes you can see it in athletes who have underlying genetic abnormalities or electrical system abnormalities that can predispose them to having cardiac arrest.
And that's what's really important here to make note of is that sudden cardiac arrest doesn't just affect certain populations or people with certain risk factors. It really can be something that affects anybody. And I hate to make this about myself, but I'm a pretty good example of this. 5 weeks ago, from the time that we're recording this, I was being discharged from the hospital after going in with some nausea myself. And then over the course of that time, having it be discovered that I had a third-degree heart block, and that included a brief cardiac arrest while I was hospitalized in Novi and ultimately had a pacemaker installed, and since I've been in good health. So it really can affect anybody, but genetics also, I would imagine, play a really big role in this.
Absolutely. Well, one, I'm glad to see that you're doing better. I can imagine that's a very scary
Yeah.
situation to have to go through. Genetics absolutely can play a big component in this, especially we call them cardiac channelopathies, an abnormal kind of the way the electrical system of the heart is can sometimes predispose people. Sometimes if they have genetic abnormalities with the way the heart muscle forms, and sometimes the heart muscle can get thicker, hypertrophic cardiomyopathy. Those are things that can increase someone's risk for having cardiac arrest. And I think what's so important is, cardiac arrest often happens outside of the hospital setting. And so being able to quickly uh, assess somebody whether they're having, if they're having a cardiac arrest and respond quickly really can be the difference between someone having a good outcome from a cardiac arrest and someone unfortunately not having a great outcome. The reality is about 10% of people will have a good outcome from a cardiac arrest. It's a really poor, people don't do very well after cardiac arrest, and most people, don't survive that incident episode. We know that when people are able to recognize it and start CPR and get help right away, that increases that by 30%. So it increases that threefold that you can actually save someone. And so I think what's so important is that people are able to recognize cardiac arrest and act quickly.
We continue now with Dr. Vaidahi Patel from Henry Ford West Bloomfield Hospital Clinics as we recognize Sudden Cardiac Awareness Month. And we talked about this earlier on as we were discussing that this can happen, of course, suddenly. It can affect anybody. It can have a variety of outcomes, and statistically, those outcomes generally aren't very good. But when you look at all of those factors and the fact that it can be sudden, it can happen anywhere to people, how do they get out ahead of this and try to maybe recognize the signs or perhaps get the proper checkups they need to see if they're at risk for sudden cardiac arrest?
Yeah, absolutely. I think, this was actually studied recently in a pretty large study where they looked, and a lot of people that do end up having sudden cardiac arrest often had symptoms prior to that, whether it be within the 24 hours prior or even the few weeks prior. And so, what I recommend is, certainly if you have risk factors for having cardiovascular disease, or even if you have a family history of sudden cardiac death, it's important to follow up with your doctor to make sure that you're being evaluated for these. The other thing I always tell people is never underestimate the symptoms that you're having. So, heart pain, the classic kind of cardiac chest pain we think about for people can present differently for everyone. Some people have classic, crushing chest pain. Some people will notice they were active and all of a sudden they've started noticing that they get short of breath with their regular activities, or that they're getting more fatigue with the regular activities. Some people get acid reflux symptoms as kind of a symptom, a mimicker of their cardiovascular disease. And there's someone that's not prone to having acid reflux, or it's not really happening with meals. So those are all things I recommend that if you're noticing that that's atypical, especially, for someone that's generally normally very active and all of a sudden they're slowing down, those are signs that you should definitely be evaluated by your doctor just to make sure there's nothing going on. And especially if you notice increasing frequency of symptoms, those are important things to get checked out.
And as you went down that list, I kind of mentally took a checklist and said, okay, check on that, check on that, check on that. I felt a lot of those things in the weeks leading up to my hospital visit in early September in the emergency room and ultimately as an inpatient because of my heart issues and cardiac issues that related to sudden cardiac arrest, like being extremely fatigued in the weeks before, having moments where I would be really energized in the morning after waking up, and then suddenly within a half hour or so be very tired again, or have moments where I wasn't necessarily short of breath, but all of a sudden I'd have a little bit of shortness of breath and a sudden recovery of that breath afterward. It was abnormal, and it would be on and off over the weeks, but those are alarming signs that maybe you should go get checked up. And a really great lesson, a really great point that you had there is if you're feeling those symptoms, if it seems like it's abnormal, best thing you can do is go and get that checked out to possibly prevent something tragic like sudden cardiac arrest. Dr. Patel, what other steps should individuals take if they know someone that may experience sudden cardiac arrest, if they witness a sudden cardiac arrest event? Like you said, those initial actions that people take have tremendous impact on the outcomes for these patients.
Absolutely. So I think, being prepared and having kind of a sense of what you would do if you see someone have sudden cardiac arrest. Obviously the big thing is if you see someone suddenly collapse, call 911 right away. Then if the scene is safe, you go and you assess that person. If they're not responding and you have help, see if someone can find an AED. Most public places, that's an AED is an automatic external defibrillator. Most public places, parks, airports, big sporting arenas generally have them and should have them. And see if someone can get that while you start CPR. Starting good CPR is one of the best things we can do to improve outcomes. And the way to do CPR, usually what I tell people is you use two hands and you're pressing into the chest at about a rate of 100 to 120 beats per minute. Um, little grim of a song, but classically we talk about the Bee Gees "Staying Alive" is a good one to sing to yourself because that tempo will give you the right kind of the right pace with which to do CPR. And you really want to push kind of in the center of the chest and assess for good recoil of the chest each time. One way that people can feel empowered, especially if you have someone who may have a predisposition to sudden cardiac arrest, is getting CPR trained. The American Heart Association does offer CPR training, which can really help you feel empowered if and when you have to deal with that situation to feel comfortable in that situation. With regards to AEDs, automatic external defibrillators, what's really nice about them is they walk you through the entire step. What they do is they will assess if somebody has an abnormal heart rhythm that we can shock them out of as one of the ways of essentially stopping the cardiac arrest if it was due to a potentially fatal heart rhythm. And so I think always trying to be aware of your surroundings when you go to these public places, of keeping in mind, keeping in mind where the AED is. There's also an app I recently learned about. It's called Pulse Point. And it's a big kind of effort where sometimes you can, it has maps of where AEDs are based on certain locations, but also an opportunity, if the community is participating in it, to contact someone who may be CPR certified, who may be in the area to come help. But I think the big things are to, assess the patient, start CPR, call 911 right away. Those are big things that can help improve outcomes for someone who does suffer a cardiac arrest.
And we know in Greater West Bloomfield, our local fire department and other EMS officials, very quick response time. And with something like this, they will put that in the priority to make sure they get you the first aid or someone else the first aid that they need, especially in a situation with sudden cardiac arrest or similar cardiac incidents. Dr. Patel, before we let you go, we've talked so much about the risk factors and so much about the symptoms and the outcomes from sudden cardiac arrest, but technology is improving. In my case, a few years ago, I may have had a traditional pacemaker with leads leading into my heart being on the outside of my rib cage, and in this case, my situation is a pacemaker smaller than the size of a AAA battery is correcting my heart rhythms now for the next 20 years going forward. How does technology and other treatments, how have they been improving to help outcomes with arrhythmias and other underlying cardiac risk factors to help possibly prevent sudden cardiac arrests in the future?
Absolutely. The one thing I can say, one of the biggest things we can do to prevent sudden cardiac arrest is, like we mentioned, those risk factor modifications, because the majority of episodes of sudden cardiac arrest do happen because of heart attacks, about 70%, 75%. And so, making sure if you've got high blood pressure or high cholesterol, making sure you're treating those both with lifestyle and, if necessary, medications as well. We have great technology that's available. God forbid if you were to have suffered a cardiac arrest, to prevent cardiac arrest in the future, especially if we know the cause of the cardiac arrest. Sometimes we don't always know that, but we have different ways of testing to try and figure that out. I think one of the things that's especially wonderful about where we are now in medicine is we have more options for genetic testing, especially if you have risk factors for sudden cardiac arrest, like family history or other cardiac abnormalities that increase your risk. And so we've moved so far ahead in our ability of being able to, one, prevent cardiac arrest, try to predict who may be at risk for cardiac arrest. We're still not great, at being able to 100% predict that, but we're getting better. And really the key still with cardiac arrest is being able to recognize it and act on it as quickly as possible.
Dr. Patel, we thank you so much for your insight on this. It's a serious issue. It can affect anybody in our community and outward, and the best thing we can do is help the community have the information they need so that they can potentially save their life, the life of a loved one, or somebody else in our communities and beyond. Any last insight before we let you go today?
No, thank you so much for having me. And the biggest pieces of advice I can give to the public and anyone really is feel comfortable with, as comfortable as you can. Try to get comfortable with being able to do CPR effectively. It's one of the best things that we have at improving outcomes for patients who do suffer cardiac arrest out of the hospital.
Dr. Patel, thank you so much for your insight today. Appreciate it.
Thank you so much for having me. It's been a pleasure.
More information from Henry Ford Health can be found either on their website, henryford.com, including resources for more information on sudden cardiac arrest and some preventative measures that you can take to help yourself or others. You can also follow Henry Ford Health on their Facebook page as well, at Henry Ford Health, for more information.